enrollment can get confusing, especially with the recent glitches on HealthCare.gov.
Now, don't let that December 23rd deadline pass. Use Angie's List tips to navigate the insurance sea. Good Morning Indiana anchor Beth Vaughn reports.
The healthcare overhaul was meant to put consumers in the driver's seat, so it's more important than ever to do your research.
Taking advantage of the open enrollment period is a time for you to evaluate what your insurance covers and make sure you assess what needs you're going to have over the next year.
When Charlie Klump of Lafayette turned 65, she found out her doctor didn't accept Medicare. She was forced to pay out of pocket and learned to always check with the doctor's office before scheduling an appointment.
I called, talked to the business office and said, now, I am a Medicare patient. That's my primary. I have a secondary insurance. But will you file that for me? Do you have any concerns about taking on an additional Medicare patient?
So while you're evaluating insurance, be sure you have a conversation with your doctor, especially if you're in the midst of a longer-term treatment plan, to be sure that you're still going to be covered.
And don't assume the plan and policy you had this year will cover all your needs next year.
People know they need it, and now they have to get it per the new laws, but they don't have an idea of exactly what they're looking for.
If you don't understand how last year's premiums and out-of-pocket expenses compare to this year's options, ask an insurance broker.
Brokers are paid actually and compensated by the insurance companies themselves. So there's no fees or service charge to work with a broker.
Angie's List warns if you choose to work with an independent agent, make sure he or she has the necessary credentials. Requirements vary by state. Beth Vaughn, RTV6.